3/4 of women going through menopause will experience symptoms, and for 1/4, these will have severe and impact their day-to-day life. Not only that, it can also impact their relationships and their social life. Today is World Menopause Day, 18th of October 2022, which happens every year on this day. It was designated by the International Menopause Society to raise awareness of menopause and to support options to improve health and well-being for all women in midlife and beyond. It is to encourage professionals and women to participate in this global awareness raising campaign by printing and sharing these materials, organising events to engage their communities, and sharing World Menopause Day on social media posts. But also it's about sharing your personal stories. To learn more about #World Menopause Day 2022 in how you can go about supporting your colleagues that are affected by this, pop over to england.nhs.uk/looking-after menopause. Even more importantly, bringing about greater understanding and the freedom to talk about menopause in the workplace. So what are you doing within your organisation right now to recognise and support women? Now, we want to continually highlight the importance of this topic and continue to support all our friends, colleagues and women every single day. We understand that the workplace can be a great provider of social support and a source of self-esteem. Now, normalising menopause at work and encouraging open, honest conversations is the right thing to do. And did you know that I have noticed that more and more workplaces have things available to women, such as pads and tampons, freely available in toilets, even within unisex toilets. So we are definitely slowly moving in the right direction. And these conversations are becoming more and more open and common. Now, World Menopause Day is an important opportunity, as I said, to raise awareness and signpost support that is available. Now, this year's theme is cognition and mood. Many people still associate menopause with physical symptoms like hot flushes, but may find the psychological symptoms most challenging at some point in their menopause transition. So, approximately 50% of people suffer from low mood or depression. 70% of people experience brain fog. 40 to 50% of people experience memory and concentration issues. Does this sound like you? Because yes, these resonate with me. Because I have been perimenopausal for about a good 3 years now. And yes, I started early. And it's funny how people's perceptions of being perimenopause is, oh, that can't be right. You're far too young. You're not even in your 50s yet. Now, I'm no expert, but from doing research and knowing my own body, perimenopause can begin in some women as early as in their 30s. But most often it does start with women from the ages of 40 to 44. I have a couple of friends who actually started their perimenopause in their 30s. So it is possible. It's marked by change in your menstrual flow and in the length of the cycle. So there's this sudden surge of estrogen. You may get some of these symptoms. Now, I know that I have some, but again, it can be quite daunting and it's really difficult sometimes to get your head around it, especially when some of these symptoms may be symptoms that you've had from other causes. So here are some examples that you may be having. So as we know, irregular periods, hot flushes, difficulty sleeping, mood changes, vaginal and bladder problems, changes in your sexual function, decreasing in fertility, changes in your cholesterol level, night sweat, vaginal dryness, joint and muscle aches, having to pee often, and PSM symptoms. perimenopause or full-on menopause can impact your mental health and well-being in so many ways, and it is not to be taken lightly. And it's important to remember there is nothing to be ashamed of or embarrassed. Menopause is a natural process that occurs as a woman's ovaries stop producing eggs and the production of female hormones, the estrogen and the progesterone, starts to decline. Menopause can also occur if women's ovaries are damaged by certain diseases or cancer treatments, or if they are removed surgically. Now, from what I understand, is that natural menopause usually develops gradually between the ages of 45 to 55. Now, during this transition time, which is called perimenopause, menstrual periods become more irregular and begin to taper off. After menstrual periods have stopped for 12 months, a woman is then considered to have reached menopause on average. Now, with perimenopausal symptoms, which is where I'm at the moment and have been, as I said, almost 3 years now, on and off, but it may not have been that early, I don't know. But during perimenopause, women may have various symptoms. So symptoms differ among women and may range from mild to severe. So hot flushes and intense sudden buildup of body heat are the most common symptoms. Been there. Some women have no symptoms at all. Menopause, as I said, is a natural condition. It is not a disease that needs medical treatment. Okay, so we've got to think about and change our mindset how we think of menopause. However, some women seek treatment for relief of perimenopausal symptoms. Now, as I said, I have recently, I'm suffering from perimenopause, and I've recently started HRT patches to help me with the symptoms. Now, from what I understand and what I'm feeling, they may be helping me, but it's really difficult at the moment because there are so many other factors in my life that are causing upheavals. Though what I do know is that my night sweats have reduced. Now, one of the symptoms is varied cholesterol levels and weight, which is something that I've been going through right now. For me right now, it's about trying different ways of treating my symptoms, whether it's medically or holistically, to find out what works for me. But what you need to do is find out what works for you by speaking to your GP or a menopause professional. And before I go, let people know what is going on in the workplace if you are suffering, if you need support. It's so important to have those open and honest conversations, as this will ease your stress and anxiety around menopause. Let me know your comments and share your thoughts about what you are going through. But remember, you are not alone, and you do not have to go through this alone. I'm Zeenat Narani, a wellbeing and mindset coach. If you would like to find out more about how I can support you to empower your mind to live the life you desire and help you find and forge your path, visit https://zeenatnarani.com. Get in touch and let's talk. Let's have those conversations. Thank you for taking the time to listen to me. Do share, follow and like.